All right. Thanks for tuning on, guys. I'm going to go over a little bit on our website, and then I'm going to go get into Healthsherpa a bit. So this is our site. I need to log in quickly. If you haven't already, definitely create an account. You can do that right here up at the top, join us. Once you submit or fill out that form, I will have to actually get in the back here and approve it. Once you're approved, you will have access to our full site. You can see some of these pages up here are a little bit different. I'm going to go through, I'm going to actually start on the right and make my way left here. So this bundle page, this is kind of just an example of some of the supplemental off-market products and some of the opportunities that we have in the off-market realm. We had a really great webinar with Lindsay that went over some of this stuff yesterday. And we'll be having Janet at 2 o'clock that will be going over her supplemental accident and things like that that are really good add-ons in these bundles as opposed to, let's say, the sick pay or the hospital expense. So I'll leave that to her at 2, but this is just a page that gives some different examples of some of the short-term medical bundles that we put together. We pair with a term living benefits instead of a critical illness policy, and you can see the premiums over here, the commission rates, and when compared with an ACA policy at full price. Now, some of these are a little dated. This price is actually probably higher this year. The savings that we can save clients if they were paying full price. Obviously, these bundles are for healthy individuals that don't have pre-existing conditions and probably make too much money to get a subsidy on the marketplace. So the short-term products are really great options for people that fall into those categories. And this page just kind of gives some examples of those. Sherpa, this is our enrollment platform that we use for ACA. I'm going to be going over this in much greater detail shortly, but again, I can't say enough good things about Healthsherpa. We're able to use this for rather than going through healthcare.gov in about 95-97% of the applications that we fill out through the marketplace. So it saves us a tremendous amount of time, and we'll be talking about that more shortly. The product section, this is really where I want to house all of basic information on our entire portfolio. I don't have a ton under this Obamacare section because really the best place to learn about the ACA plans is through Healthsherpa. But we are constantly updating this and trying to just add as much information in here to really make this a good resource for our agents for the basics. You can see here on the National General page, I've got quoting portal links, back office portal links, phone numbers. We've got some training videos as well on here and some brochures and flyers. So basically, I just want this section of our site to really be a resource for agents for basic training, basic information, so that if there is something simple that you need answered, this can be your first first line of defense. So again, we're constantly improving this product page and updating this with new carriers and new information as plans change. The commission tab just has a link to our commission accounting platform, which is Agency Block. We love Agency Block. It's made my life tremendously easier, and you can view all your statements right in there for the carriers that we're processing, which is typically just the ACA and sometimes some of the short-term medical products. But for the most part, anything else outside of that, Medicare, life, accident, those are primarily being paid out by the insurance carrier themselves. Get started. If you're a new agent, this is an important form or a section that we're going to need to get taken care of before anything begins. I definitely need the producer agreement form, specifically the a producer profile, and the second half of that is very important, so that we have all the information that we need to go ahead and get you appointed with our carriers. I then need a voided check, E&O, and a copy of your insurance license. Email those all to me. There's also an appointment request form if we want to pinpoint which appointments you're looking for, and then we also have CMS training on this as well. The Ffm certification, this is going to be free. Hopefully you guys have gotten that taken care of already. And then the AHIP for Medicare, I would assume if you're doing Medicare that's already done, because we only got 5 days here for that. So the AHIP does cost $175. We reimburse that. And typically with a lot of the carriers, they'll knock off another $50 right off the top. But we will reimburse that as soon as you sell your first Medicare policy. Now, the AHIP is very simple as far as the site itself is concerned. The test is much more difficult, and you've got to pass it within 3 tries, or they make you pay another $175. And some carriers actually won't allow you to contract with them if you don't pass it on your first attempt, or your first 3 attempts. Really, they give you 3 per time that you purchase it. But the system itself is very easy to navigate. That is not the case with the Ffm. That is run through cms.gov, and it is not an intuitive site. So there's a lot of stuff that might cause some issues, and the system needs time to process. So you kind of got to do it all in stages. I do have a navigation guide here, and if you guys are getting stuck on anything with Ffm, we can do a screen share and get you through it. So that's this page. And then the agent page, this is something that's brand new. We just started rolling this out. I've been working with our web guy for a few months now to get this set up, and we're going to be kind of tweaking it to make it exactly how we want it. But for the most part, the nuts and bolts are in here. So we have O'Neill Marketing News section here that's going to have information on commissions and product training and webinar schedules and stuff like that. This is going to be updated regularly. Again, it is relatively new, so there's not a ton of stuff in here right now, but really great, to stay in the loop with what's going on internally. We've got a to-do list here. I've got to make a few changes to this, but it's good for especially new agents just staying on top of things that need to be taken care of. I'm going to try to make these like check boxes so that we can get rid of them when you've completed them. But that's going to be useful. We've got industry news here that Matt updates daily, pulling information from the internet that might be relevant in our industry. We've got a file share, secure file sharing capabilities here. We're going to be updating. This is just junk stuff right now, but we're going to be putting this webinar and our previous and future webinars will be available here. Carrier information, product data, that I can house all of that right here, and it's 2-way as well. So if there's something that you need to get to us that we want to keep secure, you can do that as well through this. And then we have a calendar that will shortly be integrated with Gmail or Google Calendar. So that will be a useful feature as well. When you first get in here, I would highly advise setting up your profile, plugging in your it should probably pull your phone number and your email from when you filled out the form to create an account, but you'll have to add a picture. There will also be a feature here shortly to add a specific logo for your organization, as well as a marketing link from Healthsherpa. And that will come over in this landing page that I'll get to in a minute here. Those two features are not available currently, but we're hoping by the end of next week that those will be functional, so that for 11.1 we'll be ready to go and we can start marketing these landing pages, and they will look good for clients. So we've also got up here on this top bar, we've got a meeting schedule with our team. If you need one-on-one training or support, set up a time right here and we will get you taken care of. Another link to our commission portal, that's going to be available there. It'll just take you to your login. All of our agents will have their own logins, and you can view your statements there. And then this landing page, this is really, we've spent a lot of time on this, and we're really excited to be rolling that out this year. But this is going to be available to all agents when they create an account. It's actually automatically created in our system, and basically we can go ahead and market this page on Facebook, Google, banner ads, SEO, and we can push this out and try to get this in front of clients so that they can reach out to you, and we can market you as an individual agent rather than us as a whole, and then, you know, getting all these leads together and determining on where they go and stuff like that. I'm not in the business of being a lead vendor. We prefer to market for our agents as individual agents or agencies. So we want to make sure that we're doing that and we're not really grouping them, and then, you know, that's a whole nother mess that I really would prefer not to deal with. So like I said, everyone will have access to these. You guys can see your own on your page. It's going to have a contact form over here on the right that will be sent to you and only you. That, you know, someone lands on this page, they fill this out, it's going to go directly to your email almost instantaneously, and only to your email. It's not shared with anyone. And we really want to make a point of that. I even put that up here so when potential clients come to the site, that they know that we're not the ones bombarding them with phone calls like a lot of the other sites, quoting sites do. I'm going to be updating this a bit more to specifically for ACA this year, for Medicare. This is kind of just a filler for the time being, but we're going to have much more product knowledge in here, or product information. My bio's relatively short, but we've got a lot of agents that really do a good job with that as well, to really make it personal and let the prospective client get to know you a little bit. And then we've got this link down here that they can run their own quote. This is actually directly through Healthsherpa, and everyone gets their own marketing link through Healthsherpa. And it will allow people to come to the site and, you know, say they don't want to reach out right away and call you over here, or to reach out via email with their phone number and everything, and maybe it's late at night, they just want to do it themselves. They can click this link, and this will take them, well, it should. It's probably something with my cookies. Oh, there we go. This will take them right to this page that will be tied to your account through Healthsherpa. So anyone coming in here, filling out this information, if they fill out any of this stuff, this will show up in your lead section under your Healthsherpa account. And again, just your Healthsherpa account. But they can actually get in here and complete an entire application all by themselves, and you will get credit for it. And so you wouldn't even have to talk to the client. If we market this site for you and they get in here and they run their own quote and they sign up for health insurance all by themselves, as long as they went through your link, you will get paid for it. So that's a really cool feature that the Healthsherpa is giving to us. So we can also select the SEP right now, and I think it didn't work for me yesterday, but let's see if it does today. Yes, usually, and this might be because my cookies are set up and it knows that I'm in here. But a lot of times, right over here, it will have your phone number, and it'll say, you know, if you need assistance or anything, please call this number, and an agent will assist you. So that's pretty cool too. So, but like I said, they can get in here, look at all these plans, add them to cart, and start the entire application all by themselves. So that is pretty cool. Yeah, right here. So once they start this application, they can see this right here that'll pop up, and they can give me a call. All right, now let's get into Healthsherpa a bit here. So when you first log in, you're going to want to go ahead and click on your logo or your name over here on the left side. You can also access it by the dashboard. Or you can just get started and you can run that, plug in a zip code and run that quote. But this is going to be your main page. All your clients are going to be on the first page. What's really fantastic about Healthsherpa is, like I mentioned before, it's fully integrated with the marketplace. So anything that is done here, it's like you're also doing it on the marketplace. So you can upload documents through here. I'm not going to actually click on this stuff because it will show my clients social security numbers and stuff like that. So I'm not gonna get in there. You guys can try that out yourselves. But there's an option once you have EDE selected, which is enhanced direct enrollment. You'll have to go through some identity proofing. But once that is set up, as long as your FFM is in good standing and you've completed your courses, you'll be able to upload documents and pull data directly from the marketplace for all of your clients. It will also allow you to do the entire application right through Healthsherpa rather than going and being transferred to healthcare.gov. And that's going to be the case for about 95 to 97% of the time. I know last year that percentage was down slightly. It was more about 80% of the time you could do an application through here. There were some instances where, like, let's say there was a parent that was a dependent. This system was not set up to figure those unique instances out, but a lot of things like that they've corrected, and that they're able to run through their platform. Previously, you'd have to actually go and bridge over to healthcare.gov, and then it'll bring you back. But now they've really narrowed that gap of instances or situations where that would be the case. So for the most part, we'll be able to do everything through Healthsherpa. It just saves a ton of time. It's a lot quicker system, more consolidated questions, and I can usually run an application in half the time through Healthsherpa than I can through healthcare.gov. And again, like I said, you can upload your documents, you can pay premiums right through here without going to healthcare.gov. This is your lead section. This is, again, it's going to be any applications that have started, whether you've actually started them and have not finished, or if they went through and clicked on your link and they started an application but then got stuck somewhere. They will show up here as well, and they'll have all their information. This referral page, this is really great. I always keep this on. I'm set up with basically everyone other than Blue, and I just refer all my Blue over to Healthsherpa. This is how they make their money. This is how it is free for us. And to be honest, I've tried to work with Blue agents before and referrals, and it's just been a pain in the butt. I prefer the peace of mind of knowing that I'm going to get $50. It might not be, 130 or whatever the agreement is with a blue agent, but you know you're going to get it. You know that there's not some AOR issue that's going to prevent you from uh, taking care of this client. You don't have to work to stay on top of your client to make sure that everything's getting paid on time, especially when probably at least 30% of the time when you're doing a blue application, you're not getting paid for it because they previously had blue in the past and it's going to a different agent. Healthsherpa, when you refer it to them, you'll fill out the application for the client, you'll get them coverage, and then they take care of everything. They will make sure to reach out to the client for premium, for documents, all of it. It's totally off your hands. Healthsherpa does a really great job, and in my mind, I just prefer to take the $50 and not have to worry about it. They're going to pay me no matter what, whether they get paid by blue or not. So I always turn this on personally, but you have the ability to do that or not to do that. This is also another feature that I really like is that it will hide non-appointed carriers to the plan results when we're going and we're quoting products. We can then turn it on if someone's saying, "Oh, where's all the blue products? That's the one that I want." We can go ahead and click those on and show them, but it's not automatically set up. So I think that's a good marketing strategy, and I use that. This marketing section, so here is your direct link. That's going to be your specific Healthsherpa account, and when we have the process set up, basically you're just going to copy this. You're going to go over here. You're going to click the edit profile, and you're going to plug it in, and that will replace mine that is currently set up in all of these. We'll have that hopefully by the end of hopefully by the beginning of next week, so where that'll be functional. But in the meantime, you have your link right here. You can also add logos, different color schemes, and Google Analytics as well. So a lot of cool stuff on the marketing side. And then this is actually brand new. The associates, I guess, if you refer agents over, they give you $10 for every referral application that's submitted. So that's kind of cool. Let's see. I'm going to go into settings real quick. We'll go to that first. All right. So this is really important. So you're going to want to make sure that this is rock solid and extremely accurate. So because this is what pulls, this is what ties you to the policies that you write. So you want to make sure everything is accurate. You want to make sure your NPN is good and your Ffm, whatever you signed up with portal.cms.gov, you want to make sure that that is correct in here. It should give you an error message and not let you do EDE if something in here is wrong, but just to make sure that if you want to get paid on your policies, you want to make sure that all this data is correct. Also, you can plug in our join code that will link us together and make sure that we have the ability to do audits and make sure that all of our agents are getting paid and the carriers know which policies that are ours. So I appreciate it if you guys link your accounts to us. It just gives me visibility. And like I said, we do audits a couple times through Open Enrollment and a couple times after Open Enrollment to make sure that anyone selling policies in Healthsherpa, we're making sure that we're getting paid on all of those from the carriers. So that is helpful. And there's also a section here that will send you reminders from your email to the client to remind them to make payments. So you can set that up as well. Carriers, you definitely want to make sure before November 1st that this is accurate. Right now, Bright is not part of this. So hopefully in the next week or so, they'll be updating this with all 2020 information. We'll be able to see the 2020 rates and plans. Usually, I think last year that was around the 15th where they had a toggle between 2019 and 2020 through Healthsherpa. And as soon as that goes live, I'm sure they'll add Bright to this as well. But you want to make sure that all the carriers you're appointed with are checked off so that they're tying your information and sending it to the carrier when you complete an application. All right. So let's get into the quoting. All right. So this is where you're gonna spend most of your time. It's gonna be right up here on the quoting section in the top right corner. You can also do it right in the beginning rather than going to the dashboard, but you just go click quote up here in the top right corner. You're going to plug in your client's information over here. This thing is on the left-hand side. This is going to be referring to people that are actually on the plan. So don't include people that are not going to be included in the plan. However, over on the right-hand side, this is going to include anything that is filed with the IRS. So total household members, whether they're on the plan or not, total household adjusted gross income. So this, I always make sure that we get with the client. We say, it's whatever you're filing with the IRS. So if you've got dependents, include them here. It's got to be accurate. The income has to be accurate to the adjusted gross income that you are filing with the IRS. So let's plug in something here. A little more. And that will pop up their subsidy. Okay, so we'll be able to see over here that they're getting a $313 a month subsidy. And then it will adjust their premium. So this was the original premium, and now we've got our adjusted premium for this client. You can actually see all the plan benefits right in here. This is kind of an easier to view summary of benefits. I really like this view. That'll go through, for the most part, everything you need to know about each plan. Of course, you do have the complete summary benefits for each plan right here. And that will give you basically everything you need to know. There's also doctor lookups, drug lookups for all carriers and all products. Ambetter does a really good job with this. I think most of them do. And then they've got drug lists as well that'll show you tiers and things like that. So again, you can see that Florida Blue is checked off here. And you can also see Oscar's not included in here, and Bright, which will be in the Tampa area this year. So right now it's just pulling 2019, but I believe last year there was some toggle, I think it was over here, that would let you go between 2019 and 2020. And that should, like I said, be live here shortly. So you're going to be able to see all of your plans here. Like I had mentioned before, this is really the best place to learn about the plans, especially once the 2020 ones come out. Definitely get in here and take a look at the different products that are available. This was really my go-to last year. It was one of the cheaper silver products available. That covered doctor's office visit copays, generic drugs. For most people, this was, in my opinion, the best option for the cost. One great thing about these silver plans is the cost savings reduction or cost share reduction that will actually adjust the deductible and the benefits based on income. So you can see here on this plan, $133 a month. You can see the deductible, whereas the bronze, these are static. It doesn't matter what the income is. But if you look, let's go up here, change this to 20,000. Go to the same plan and Better Balanced Care 11. Now we've got a lower premium, obviously, but we also have a $0 deductible. We have $7 doctor's office visits and $7 copays for generic prescriptions. So, and the out-of-pocket max is adjusted as well. So those are a really cool feature about these silver plans. So keep an eye out for that. And then, yeah, so all your plans are going to be here, all learning about each plan. Again, try to get familiar with the plans in the areas that you've got clients. And then you just add to cart, and then you can start the application. Now you can access healthcare.gov right here. You can go down to Florida and access healthcare.gov, or as long as you have enhanced direct enrollment set up, you can do the application all through Healthsherpa right over here. So again, this is where you're going to want to be. And like I had said before, it will save you about 50% of your time. So and it will also pull any previous applications, just like when you're starting on healthcare.gov. It will pull, you can search via just social security or first name, last name, date of birth, and it can pull anything that was on healthcare.gov. So let's see. I guess lastly, I'm just going to talk about dental. This year, there is an option of dental on Healthsherpa, which is good because it is available on healthcare.gov. I have stayed away from it personally as an FMO, simply because they don't pay good commissions. So it's basically like 10%, I think, is their commission rate. And that just doesn't leave room for an FMO. So, if you guys are interested in getting contracted with these carriers, by all means, go ahead and do that. But I'm kind of staying out of that because I don't feel comfortable taking a percentage of 2 and the commissions are that low. Now, on the other hand, this is more of a convenience thing, and that's why their commissions are so low, is because it's all integrated into healthcare.gov, and all you've got to do is go like this, and it can be one bill to the client. And I understand that. That makes sense. Personally, I really like Emeritus. They're going to pay at least double the commission rate, and I think it's just as convenient, to be honest. I mean, you do have to get select payment twice, but whereas I think you can do it all together if you're doing it through healthcare.gov or through Healthsherpa. But the Emeritus is just a link that's personal to you, and I have mine right up here. And then it's an extremely easy application, and again, you're getting at least double the commission if you can deal with giving up the convenience of having the dental right there. I really like Emeritus's plans. Their first dollar coverage, the first day you have coverage, even on major, it's a smaller percentage, but even day one, I know a lot of plans will make you wait at least 6 months or a year before you're getting anything on major services. This is at least something day one on major. So I think that's something that really sets them apart, because like I said, a lot of them, they don't cover major at all until 6 months or a year. They've also got vision plans here. I personally have my dental and vision through Emeritus. I have not had a problem with their networks or anything like that. I think they're great products at reasonable prices. So I highly recommend Emeritus. Very easy to get contracted and get set up, and you get your own personal link, kind of the same deal that Healthsherpa gives you your own marketing link. This is your own personal link. You can send this link out to your clients. They can sign up themselves. Anything done with this link will be tied to you. All right. I think that's a good overview. I don't want to take up too much more time. We do have Janet coming on at 2, which I highly recommend. She's going to be talking about supplemental health products, accident, hospital indemnity, and some really great options with Washington National and potentially a couple other carriers that she's working with. So stay tuned for that. That's going to be the same link. At 2 o'clock. If you guys just want to leave this up, you can do that. Do you have any questions for me? Feel free to type in the chat. There's also, I think, a button to raise your hand and I can unmute you, or a Q&A. I think there's also one of those in there. I think we got someone in the chat. Hi, Lindsay. Any questions? All right, guys. Thanks for tuning in. If you do have any questions, don't hesitate to call or send an email. And like I said, in about 15 minutes, we're going to have Janet on. Oh, we got one. If I already have a Healthsherpa account that I have not used in a year or so, will that work under O'Neill or will I get a new account? So that depends on how you set it up originally. If you just set it up yourself, that should be fine. You can probably just go into your settings and just add our join code, which is 6334. That should also be in the emails that I sent you. Again, that number is 6334, and that will tie you to us. Sometimes if someone else set up your account, specifically I had this happen with an agent this week. They had an account through a captive agency that was selling actually Molina back in like 2015, and they could only sell Molina, and it was actually it caused us a bunch of problems because for some reason with the cookies on this account, once you had logged in once, we tried creating a bunch of different accounts with different emails, and it kept showing that it was captive with Molina, and it would not let us choose any other carriers. If something like that happens, just get with me and we can get with Healthsherpa, or you can call or chat with Healthsherpa down here in the bottom, and they can help you get that fixed. It's usually a cookie issue, and then we just need to create an account with a new email. But for the most part, if you've set up your own account previously, you can just continue to use that. That's fine. I did forget one thing. So Healthsherpa has Intercom just like we do, and I did not point that out on our website. So we also have Intercom feature where you can reach myself or someone else with our team as well if need be right through our website. So that's kind of cool feature too.